Good morning, everyone. Turning now to health news. Yep, it's that time of year. Time to start thinking about your coverage options. Honestly, though, it can be really overwhelming and actually confusing, but lucky for us, our friends at United Healthcare have all the tools that we need to figure it all out. Please welcome back CEO of United Healthcare, Medicare, and Retirement in Georgia, Greg Kunemund. Welcome back.
Oh, great to be back. Thank you.
I know it is overwhelming. Everybody out there is thinking, oh boy, this is why Greg is here today. We're going to dive right in to questions that you probably have been pondering the last month or so. For seniors and other people enrolled in Medicare, why is this time period so important?
Yeah, well, it is great to be back, and it's that time of year again. So the Medicare open enrollment period started on October 15th, and it ends on December 7th, and that will be for elections for 2018. So what I really stress is, for seniors, it's their one chance a year for most of them to make their decisions and their healthcare decisions, which is really, really important for them.
Right.
So,
and what advice do you have to offer to help make that process just a whole lot easier?
Well, don't stress out. There's a lot of tools and resources that we have out there. And Medicare sometimes can be confusing. In fact, you know, my mom and dad told me that, and so do my neighbors and friends. About 40% of a survey we did at United Healthcare found that seniors needed a better understanding of Medicare. So I would definitely take a look at the options that they have. Don't be afraid. There's tools that we'll give, resources, websites, and phone numbers that they can call. But the way I really break it out, Christine, is really choice, care, and experience. And if I could talk about choice, which is really going to be, you know, Medicare is not a one-size-fits-all. There's choices, Medicare A, B, and D, Medicare Advantage. And, you know, you don't need to take the same plan as your spouse. So you want to look at the choices that you have and what's available out there. And then I would ask, you know, a couple basic questions. First, start for this year. Was the Medicare plan you're on today, did it meet your health care and your financial needs?
Exactly.
That's really important. And your budget is important when you make a selection for your plan. So it may not only be the premium, such as your A, B, or Medicare Advantage, but you have co-payments and co-insurance and different out-of-pocket expenses
and your drug
that
costs,
you have. Yeah, and really drugs are key, right? You want to make sure your drug is covered. Is it a generic? Is it a brand drug? Is your pharmacy in the network? So you really want to ask yourself those three simple things.
Excellent. And then, okay, so Medicare Advantage, one of the options many people consider, and I understand it's really experiencing some rapid growth over the years. If anybody's wondering what is it and what is driving that growth, kind of break it down for us.
Sure. Well, Medicare Advantage are also known as Medicare Part C plans. And I've been on here several times and we talked about the ABCs of Medicare.
Right.
So the Medicare Advantage plans cover your Medicare A, your hospital, B, your physician and outpatient services. And many offer additional, like your Medicare Part D plan. So it's really a sense of ease. It's one card that you have, you show your pharmacist or your physician. But the real beauty of the Medicare Advantage plans are they cover additional benefits, which are really key. For example, my dad likes a fitness benefit. My mom had dental, sometimes has hearing aids or transportation. And these are things traditional Medicare may not cover. And so here in Atlanta, over 4 out of every 10 that are enrolled in Medicare selected a Medicare Part C plan or a Medicare Advantage plan because of those benefits of fixed costs and a sense of ease.
Right, and you mentioned, we put it up for a minute again, Part A, Part B. The crucial elements of each of those.
Yeah, well, Medicare Part A, if you think of when you enroll in Medicare, you get your red, white, and blue card, and we'll have your Medicare Part A. That's really your hospital and your skilled nursing facilities. Medicare B is your physicians and outpatient services. So for your hospital, there may be co-insurance that you would pay and deductibles, and B, your doctors, you would pay at 20% of the Medicare allowable. And the Medicare D plans are your prescription plans where you would have some co-payments.
Okay, the best part is you mentioned resources. Tell us how we can learn more and just really get well informed before we go into the new year, perhaps not as prepared as we want to be.
Well, think about choice, care, and experience, right? The care, your physician you want to have in the network, and your pharmacy, and experience, who do you want to partner with? So United Healthcare, we have a couple good sites, uhcmedicareplans.com. I believe we have an 800 number also available. Medicare.gov is a general site for people, and they also get a Medicare and You book. And then for boomers and caregivers, I really like this site. It's called Medicare Made Clear, and they can do that research and understand the choices, the selections, what Medicare A, B is, and why it's really important to make that decision. Because if they stay in the plan they're on today, which they may want to, but if they don't do their research, it's automatically going to be enrolled for the following year, which may be a good thing, or perhaps it may not be the right plan for them for both their health care and their budget.
And you mentioned December 7th. You have until December 7th?
Yeah, for most people on Medicare, December 7th is the
good.
last cutoff, and that would be for an effective date of January 1st.
All right. Thank you so much. We
You're
appreciate
welcome.
your time, as always. If you'd like to learn more about your Medicare options, visit MedicareMadeClear.com.